Welcome back. Well, the outbreak of the coronavirus has already affected the workplace in other countries. In South Africa, 2 cases of COVID-19 have now been confirmed. So how is this virus going to affect workers and employers? Joining us now is Labour lawyer Sherisa Rajah. Thanks very much, Sherisa, for coming into studio.
Thank you for having me.
We were just discussing it now, the fact that, you know, our economy is already on the brink. There are a whole range of issues that we are trying to get abreast of to get our economy back up and running. Coronavirus is the last thing that we need.
It couldn't have come at a worse time. I think the concern from an employment law perspective is the Occupational Health and Safety Act puts a positive duty on employers to take all steps that are, it says, reasonably practicable to ensure the health and safety of its employees. Now, the concern is, and we've seen that Nedbank has come out saying that they've sent a division or a team of their division home to work remotely because they were in contact with a gentleman that was tested positive for COVID-19. Now, the concern is, how do we manage the time prior to or during the incubation where there was contact? And if there is a risk, the Occupational Health and Safety Act places a positive duty on employers to take steps. Coupled with that, the MEC was talking about the panic, and there is panic. You see it in the media. The concern is that as an employee, I have the right not to tender service in a way that you may request, and I have a protection against victimization if I feel that you don't have my health and safety at the forefront of your operation. So employers are in a little bit of a conundrum now in how we respond proactively, but also in a way that keeps productivity at a manageable level.
And then there's this huge issue of this whole segment of our economy, and that's, for example, domestic workers. We know that domestic workers, the majority of the time, get paid for days worked.
Yeah.
So how do we protect ourselves as an employer of someone, but how does that employee protect themselves as well?
Exactly right. I think that's the biggest concern, that if this affected in any measure an employee who is only paid for days worked and does not get the basic protections of our laws, how is that going to control, how are we going to proactively control the spread of that? Now, domestic workers, the South African climate is nuanced because we're one of the few jurisdictions where we have homes that are fully outsourced in terms of domestic workers, gardeners, dog walkers, you name it, we found a way to do it, right? The concern is, those people, are they really going to be entitled to paid time off, sick leave, right? The other thing is, do they come forward and say, hey, you know what, I have this flu, I have a fever, I feel a little bit malay, can you help me? And then you'll say, sure, I'll take you to the doctor.
I mean, the answer to that is probably not.
It's the informal sector is alive and well and thriving, and we've tried our very best to confer protections with the National Minimum Wage Act, etc. It's done very little. There are still people being paid 120 Rand a day in circumstances where we throw that away for a cool drink down the McDonald's drive-through. Coupled with that, in the formal sector, we talk about immunocompromised people. How many people do you know in your workplace that have HIV/AIDS, etc.? These are things that sadly are still frowned upon in our environment. Wrongfully, but it is the situation. Now, how are we going to protect them? And a lot of the measures that we've put in place already at client organizations are hand sanitizers. A lot of remote working is going on right now. We're seeing conferences being converted into online webinars, etc., to try and limit the spread of infection, etc., purely because as much as we have the right to process personal information in relation to employment, people don't come forward. And I can only work with your consent. So if you don't give me consent to test you, how am I going to manage that?
Yeah. And then the other, I mean, there are so many, the issues are just so wide-ranging. What about someone who is traveling? You know, so I've gone on holiday, I've taken leave, I've traveled outside of the country. Does my employer then screen me when I get back?
So what we've been doing, the practice is we've rolled out a mandatory 14-day isolation period for anybody traveling. So a lot of the multinats do business in rest of Africa, premise in Johannesburg. Francophone is a huge hub of activity. We've had massive delegations come back, get called back into country, get put into isolation, and they're getting special time off. So
or they're able to work remotely, I suppose.
They're working remotely to the extent that it's possible. But let me give you a scenario. One of my clients calls and says, hey, I got your advice, thanks, but here's a problem. The guy that's just come back says he has prepaid electricity, he doesn't have good internet connection, what do I do? So then we look at, well, can you Airbnb the gentleman? What is the cost of that, and how does he come to the party in terms of, well, he would have otherwise had to pay for his travel into the office, so maybe we do a 80-20 split. But these are the things where we have to now negotiate in the employment landscape, where we didn't think these were employment law concerns prior to COVID-19. My hope is that COVID-19 is one scenario that forces employers to look at the prospects of remote working so that we can reduce our carbon footprint and actually just create a healthy remote and maybe even virtual workplace. I will say one last comment is that one of the entrepreneurs I've been working with on the Future of Work rollouts has come out saying, I will give you free access to pilot my virtual workplace in your workplace for 30 days. If you think it's something that can work, you call me and we'll decide after it. But that 30 days is enough to help employers manage the risk in the workplace, because I assume that in the 30 days we're all going to be working very hard to come up with some kind of cure for it.
So how do you reckon this is going to change possibly the landscape of the normal workplace where you're required to come in 5 days a week, 8 or 9 hours a day? Might there be some positive outcomes?
I cross my fingers. I really hope so. Look, a lot of our multinationals in South Africa are already implementing 4-day weeks, remote working, work from home, but we haven't gone into the space that we're seeing in the global economy where we have virtual workplaces. I mean, last week Tuesday was the first time in my career where I've spoken at conferences all the time, but last week Tuesday I dialed into a conference, well, not dialed in, I logged into a conference where there were 17,000 people watching me, and I had no idea who they were, from all over the world, EMEA, APAC, etc., and we spoke about future of work and what we're doing. The colleagues on my panel in Africa, we were all committed to the work we're doing, and it seems that remote working is happening, particularly because we understand the working woes of working mums, parents with little kids, etc., and also because childcare and schooling is becoming increasingly expensive, and our GDP is hard hit. So we're in an economy where we need to protect our middle-class tax-paying bracket.
I hear the officers in Denmark are incredibly happy. They work 32-hour weeks. It's all sunshine and roses. Perhaps just before we let you go, if I am someone who perhaps has a small business, who employs a number of people around the home, where do I go to just get information on what the right thing is to do with the people in my employ?
So I would look at NICD. I would follow what they're doing. I would follow the Department of Healthcare. They're releasing communication on a regular basis. And what a lot of the clients are doing that I service is we're releasing that to the workplace as a communication. And I think small businesses need to do the same. Put it up on a notice board if you don't have emails. Pull out the old one. Make sure that you've got hand sanitizers. Make sure that you limit traveling unless it's really, really necessary. And just practice safe and transparent communication, because at the end of the day, if someone is immunocompromised, you need to create a safe space for them to come forward so you can protect them specifically in your workplace.
Incredible advice. Thank you so much for coming into studio. Sherisa Rajah is a labour lawyer. I think probably best to just log on to the NICD website, get some advice there if you need it.